some are covering only the hospitalization, some are covering only the surgery charges. So still, it's a very big hole in the pocket of Indian public, and that's why it's not affordable. And that's why in India they says that the organ transplants, especially like heart or the liver or pancreas or the lungs, are for rich, super rich people only. And it was reported earlier, now the government has become strict, that earlier the NRIs or those foreign citizens, they used to come to India for the transplants from Middle East and other countries, because India, the availability of organs were there, which they used to get. For the brain death people, the organ transplants are taking place. But again, the question of affordability, because transportation of a organ from one city to the other city is very expensive. And unfortunately, even the airlines people, they are charging a bomb. Even if the seats are available, they charge the maximum rate. Even for the charter plane, I know the incidents. One charter plane was taking place from Mangalore to Chennai. The cost, negotiated rate was 5 lakhs, but they charged 8 lakhs rupees just to transport the organs. So this is the condition, because everyone think that why not snatch or take the money out of the pocket. They forget one thing, that this is a question of life and death, and there our sensitivity is totally dead. Whatsoever we claim that we are very sensitive people and we are very human people, but I think we are not at all, because we are charging, although it should be free of cost. Green corridors they are making, but what is the use if they have the recipient has to pay so much money? How a poor person can afford to pay 20 lakhs, 25 lakhs, 35 lakhs? That is only for at the time of surgery. What about the afterwards? Thank you very much for listening me patiently. But now, today we are very lucky to have a very elite and knowledgeable, those who are authority in the field, panelists are with us. And to discuss the topic, we have, I would like to invite my first panelist guest. He is Professor Dr. S. Vasudevan. Professor Dr. S. Vasudevan is the chairman of IMA Standing Committee for Organ Donation. He is the professor and head of the department, Urology, Government Medical College, Thiruvananthapuram. Professor Dr. S. Vasudevan, welcome to our show. Today, you are there and you know the conditions, how the India is suffering, and the condition of Indian organ transplant in a very, I can say, very initial stage in one way, because we are almost the bottommost in organ transplants and organ donation mainly. So we would like to know from you the economics of organ transplantation in India. Professor Dr. S. Vasudevan, please.
Thank you, Mr. Lal Goel, for this opportunity. And I know your passion for organ donation as well as transplantation. So that makes it a very good partnership. So coming to the topic at hand, we know that definitely the diagnosis of chronic disease needing organ transplantation is a huge game changer for the individual, for the family, for the friend circle around, as well as for the society and the nation. So when you consider that, we have to evolve strategies whereby this money is saved or money is well spent when you consider the costs involved. So when you come to the treatment protocols, we know definitely that compared to the conservative means of treatment or the option of dialysis, which is available for kidney failure, transplantation is definitely the best cost saving in the long run. So that is why we need to promote transplantation wherever possible. Now, I wish to refer first to a paper which is published by Vivek Kutte in 2010. He has estimated that 2% of ESRD, end-stage renal patients only receive transplantation, whereas 37% are on dialysis and 61% are receiving no renal replacement therapy. That is, they are not receiving scientific therapy which is needed for that at that moment of time. Again, we know that this is a resource-intensive service, and there is definitely increasing scrutiny on how we spend our money, because the various stakeholders include the government, the health insurance companies, and we should also understand there are a lot of uninsured individuals around in our society. So we need to carry them also along. So we need to make a strategy whereby, I remember during my resident days, it is still happening. Whenever a patient needs a AV fistula or in transplantation, immediately they resort to, most of these are very poor people who come to government hospitals. They immediately resort to crowdfunding. They form an account, and there are individuals who help them to get money for all these things. So this has now gone on to crowdfunding also. So these are the ways now people raise money, especially the uninsured people. Again, the newer things which are coming into this are, you mentioned about disease donor, the thing. There is a definite cost which is involved in live donor, because though it is altruistic, there is definitely a cost, because the recipient has to bear the cost of the donor also. Also, there is a lot of money transfer which is happening illegally. So we need to really understand that and recognize that it is definitely there. Another thing is, we need to know that now with disease donor taking place in more numbers, also a lot of marginal donors are being taken. So we need to know whether these are really paying off in terms of organ survival as well as patient survival. So organ quality, the recipient's characteristics. So is every individual, every recipient, do they really need a transplant? Will they benefit from a transplant? Or these are coming into scrutiny. Allocation policies are also being scrutinized now. And lastly, we need to understand that the presence, increasing use of cardiac death, that is the disease cardiac death leading donation, there is a more, initially it appears that the benefit is not as much as in others. So we need to know that really what we can do to improve the quality of these DCD organs also. And lastly, we need to understand the impact of this in the family. There is loss of employment for the recipient initially. Later on, if it is a live donor, the donor will also lose the employment for some time. As for organizing this procedure, a lot of wealth may have to be sold off. So ultimately they become poorer. And what is the cost of this? The immunosuppressants which have to be carried out lifelong. So all of this have to be examined and a policy has to be brought about. I think these are my initial comments, and thank you. And let us move on.
Thank you very much, Professor Dr. Vasudevan, for giving your views. And as you rightly mentioned about that, the cost has to be borne by the living recipients for the living donor. And so many cost factors are there. The main thing is about the insurance company. If the government is not, although there is a recommendation from the labor department, because we had a media conference and we suggested at one time, so the one-man expert commission under the chairmanship of Dr. C.V. Anand Bose IAS, they have recommended to the government to cover all the organ donation irrespective of cost, whether it's a lung or this thing, for the BPL workers under the Ayushman Bharat thing. But it has not yet been approved. We hope that it will be approved, to at least the poor and those who can't afford will definitely get the benefit, and then definitely the organ transplants will increase drastically. Thank you very much, Dr. Vasudevan. Now I would like to invite my next panelist guest, and he is Dr. V. Raman Kutty. Dr. V. Raman Kutty is the health economist and emeritus professor, SCTIMST, Trivandrum. Dr. V. Raman Kutty, you are a renowned economist of not, I will not only say India, but your name is there in the globally known. We would like to know, and you are basically for the health. That is a very, very important point. You understand the basics, why in India, what is the problems, why these organ transplants are not taking place, although we have so many competent doctors, we have very good infrastructure, we have private hospitals, very good. Even the government hospitals, they are ready to do all these things, but that we are not getting because of the affordability as well as the awareness. We would like to know your views about the economics of organ transplantation in India. Dr. V. Raman Kutti, please.
Thank you, Mr. Goel and Dr. Vasudevan and all the other experts in the panel. And thank you for this opportunity and good morning to all of you. I really have not made a very deep study of this situation, but I will make some general remarks. As you rightly said, transplantation of organs is an advancement in technology which has been around, available in the world for at least 50 years now, I think. And it has steadily improved in its technological finis, so that now it has become a routine and very much frequently done procedure in many countries. But unfortunately, in India, we have not been able to get the full benefit of this particular technology and this particular development in science, in the medical science, which is very unfortunate. And I think there are several reasons for this situation. If you look at it from an economics point of view, you can look at both the demand and the supply side. What is happening is that being a high technology intervention, you need very sophisticated hospitals and personnel to do this. And that is one of the reasons why the cost goes up. And many of these technologies are expensive, but that doesn't mean that they should be denied to people. So when you see the scenario, what we find is that whenever there is the supply does not meet the demand, then the price goes up. That is one of the reasons why it remains expensive. That is not the only reason. Of course, the technological intensity is also another reason. But unfortunately, in India, there are a lot of barriers, like there are a lot of ethical, legal barriers, which we have not really addressed. And, we are experts at beating around the bush, and we don't really address the issue. We know I don't want to, we have only very short time, so I don't want to go to these issues, the court cases and all that, and the accusations of about what is happening in private hospitals. I mean, I don't think much of it is true, but there is always this creation of this air of suspense and mystery around it, which is very bad for the people. So I think the authorities or whoever is in charge should take steps to have a dialogue and brush out all these suspicions, and maybe the courts also should make it more facilitatory. That is, if somebody wants to donate or somebody's family wants to donate, things should be easier, and there should not be this air of suspicion around stealing organs and all that. And I think that is very bad for ultimately for the people who suffer. On the other hand, on the demand side, of course, most of the people who need this technology are poor people. As you know, most of the people in India, the large majority of people are comparatively poor. Of course, over the years, we have improved in our economic performance. And I do think that in the future, we will have better economic status. But generally, even now, there are a lot of people who just cannot afford this technology on their own. They can't pay out of pocket. The people who can finance their own transplant will be very, very few, only the rich and powerful. This is very important. For powerful people, you don't need the money. The state will find a way of funding them. So, which is also very funny because it's a very iniquitous way of supporting medical care. Everybody should be considered as equal. So that is the situation. So what do we have? We have only about 1% of the GDP which is spent on health by the government. So which they definitely should go up, and that is what the government is trying to do through the Ayushman Bharat. But I don't know how far, the way, I don't want to go into the details, but the way I have seen the guidelines, I don't think they will reach there. I don't think that the real provisions for improving the funding is in place. So which means there will be a shortfall of funding for the poor people, because the government funding is the only thing that they have. So that means, in economics, there is this dictum that rationing happens either by price, which means that the rich will get whatever they want. That is called rationing by price. And this is what is happening in India. or there is what they call rationing by time, which is like you have to wait in a queue. That is what happens in many cases in situations like the NHS, where there is a wait list for many procedures. And in India, even if you have a transplant program, people may be waiting because if the government funding is not adequate, not everybody can be done at the same time. So which means that you're put on a list, and by the time your turn comes, unfortunately, it may be too late. So that is what is known as rationing by time. So both these mechanisms actually lead to a very iniquitous situation. So we need more funding, and of course the government has to improve its funding for health, which is they have been talking about it. I think from as far back as 2003, there was a health policy document in 2003 which spoke about doubling the funding for the health sector, which I don't think it has happened even now. We are still struggling at around 1%, under 2%. Many countries like Thailand, even China has gone to 3, 4, 5% of GDP spent on health. And if we have more finances on this, we can divert some of it into high technology areas like transplants and other situations. Now, even that, but now what is happening in many situations, especially in a context where the media is very active, especially in a state like Kerala, what we find, as Dr. Vasudevan pointed out, is that there is a lot of crowdfunding happening. Every day, you have people asking for money for poor people, for this technology, that technology. But then, you cannot make a choice. This is why I want to talk of this specifically, because recently I have found appeals for very rare diseases where they're asking for funds like 18 crores, which I don't know whether they will get. Even if they get for one dose of medicine, it is not going to be easy to sustain that. So it is a much better option to use that for options like transplant, because that works. We know that it works, and that person will have many more years of productive life. There is no point in, this may sound cruel, but there's no point in it. They show a child who is affected. Of course, it's a very pathetic situation. But then some rare enzyme which has to be injected, which costs 18 crores, and people give money. I think it's a waste of money. I think it should be directed towards productive areas like transplant, especially kidney transplant, where it is known and the world has demonstrated that's a very effective technology. There are lakhs of people, I think, around the world who live on transplanted kidneys, and we Indians are denied this because of unfortunate situation. And I think that I will stop there. I think basically that is what I want to say, that there has to be increased government funding. There has to be a direction on the laws and ethics and of the situation should be more transparent. And of course, we should promote this technology, and we should promote organ donors, cadaver donation, all sorts of whatever is possible ethically, we should be doing that. And I think I will stop with that. Thank you.
Thank you very much, Dr. Raman Kutti, for giving your views. As you mentioned about the one disease which cost about 16 crore rupees for the medicine, that is for spinal muscular atrophy, SMA. And unfortunate part is even the custom duty is there on the over and above. So in every time the patient, when they import that, they have to appeal to the government, and then government shows a they oblige by waiving off. They should waive off all these duties, etc. They should not charge anything even for the organ transplant. And you rightly said that in India it requires, and you mentioned about NHS. NHS, I will just tell you, in UK, there were earlier in 2019, 700 people died for want of organs. Although UK is 1/20th of India. So if we multiply 20, it works out to 14,000. But in 2020, only 400 died, 8,000. In India, official figure is 5 lakhs. Although I am sure our panelists might be knowing, doctors knows that this official figure is not the correct figure. The figures is far more, because the rural doctors, many doctors, they never diagnose what is the reason of the cause of the death, and they say natural death or heart, this thing, but they never mention about the liver problem or the lungs problem, etc., etc. So in that, because NHS is covering everything there. So there is no problem, as well as there is an opt-out system which now adopted by the UK on 20th of May last year. And that is why people are, once they become adult, they have either they should opt out, otherwise they are deemed to be an organ donor. Here in India, it's a voluntary. As I mentioned, that if I have filled up the form and tomorrow, if I will be declared as a brain death, my family says no means no. Even on natural death, the tissues cannot be taken out unless my family, immediate family will say. And one of the family members says yes, two will say no. And this is happening every day in India. Otherwise, we have almost 1.65 lakhs accidental deaths, out of which 1 lakh is brain death. If those 1 lakh brain death saved, if they will donate their organs, I am sure we are not going to organize such type of programs, because we don't require so many organs will be there. But that is where the role of government is required. Thank you very much, Dr. Raman Kutty. I will come back to you if once the round will be over, and definitely we will hear from you more. Thank you very much. Now I would like to go to my next panelist guest, and he is Professor Dr. Vivek Kutty. Professor Dr. Vivek is the Secretary of Indian Society of Organ Transplantation, ISOT. He is the Professor of Nephrology at IKDRC Ahmedabad. Dr. Vivek is very much involved and very dedicated for this organ transplantation as well as organ donation. Now, he's suggesting, and that's what he's going to highlight, and he's going to enlighten all of us. His suggestion is that we should have a white paper or suggestions to be made to the government for affordable transplantation in India. Now, why he is saying and what are his suggestions, I think it is better that we should hear from him. So the economics of organ transplantation in India, Professor Dr. Vivek Kutty, please.
Thank you, Mr. Goel. Transplant economics.
Your voice is a bit low, doctor.
Am I audible?
Now you are audible. Yes, please.
Okay. Thank you, Mr. Goel. Transplant economics is the emerging field for transplant scenario in India. Let us first see what is the transplant scenario in India. As per data submitted by National Organ and Tissue Transplant Organization, NOTO India, to the WHO GODT registry, around 12,700 transplants are done in India in year 2019, and 7,500 transplants are done in India in year 2020. 70% are kidney transplant, 20 to 25% are liver transplant, and only less than 10% are heart, lung, pancreas, and small bowel transplants. We have around 500 transplant centers in India, but 80% are in public sector. In private sector, and less than 20% are in public sector. By and large, the cost of any organ transplant in government hospital is less, and it is 2 to 3 times higher in any private sector hospital. Transplant cost for organs other than kidney and liver, they are less affordable for a common man, especially for the heart, lung, pancreas, and small bowel transplants. I am working as a professor in Kidney Institute, Ahmedabad. This is a public sector transplant hospital in India. We have completed around 7,000 kidney transplants and 500 to 600 liver transplants. And the only single step of success of such a high volume transplant program in public sector is a financial support to the poor patients. We have various government schemes like Chief Minister Fund, Prime Minister Fund, Ayushman Bharat, and other state government schemes like Ma Yojana, where transplant and dialysis is free of cost for a common man. So in Western world, we see that blood group is not matching or immunology is not matching is a common cause to prevent access to organ transplant. This is dictum for the developed world like US or UK. But for India, the most common reason which prevent access to organ transplant is financial incompatibility. So we must provide affordable organ transplantation, access to organ transplantation. Since less than 20% of transplant centers are in government sector, we should increase more access to transplantation in public sector hospital, at least so that transplant services will be available to a common man. The second important way for the kidney transplant, when blood group is not matching, there are two options. One is paired kidney exchange and other is ABO incompatible transplant. There is no extra cost required for paired kidney exchange, but ABO incompatible transplant is 2 to 3 times costly as compared to the paired kidney exchange because of cost required to carry out desensitization protocol. So Indian Society of Organ Transplantation has made the guidelines 2 years back on how to do transplant for kidney patients who are having healthy willing but incompatible donor. So in India also and worldwide, it is said that paired kidney exchange should be encouraged over incompatible transplant, not only because this is cost effective, but the outcome, long-term outcome of living related paired kidney exchange is much better as compared to the incompatible transplant. Then in our public sector hospital, we use a generic immunosuppressive drugs, which are much affordable for a common man as compared to the innovative drugs, which are almost 2 to 3 times higher cost as compared to the generic immunosuppression. If we see the transplant scenario in India, 80% are living donor and less than 20% are deceased donor. So how to increase awareness of deceased donor organ transplant in India? I will suggest that a mobile caller tune based on organ donation theme can be in use to educate a common man, just like we did in COVID pandemic. The COVID caller tune was most effective, rapid way, and it was also economic to teach a large population in India. So in a similar way, we can use a mobile caller tune on organ donation theme to educate a large population. So I think it can be doable, and this will increase awareness about the organ donation, just like you said, the opt-out system in India. So we would definitely increase the disease donation in India. Although India is the third largest country in the world in terms of organ transplant, but this is mainly because of living donor transplant. If we came to the deceased donor transplant, India is far behind as compared to the Spain and other worldwide scenario. And most importantly, prevention is better than cure. So we should screen for the organ failure in high risk population, just like for the most common reason for kidney failure is blood pressure and diabetes. So we should do a regular screening, yearly screening in high risk population, because we don't have too much GDP expenditure on the health. We don't have the national healthcare insurance for a common man. So I think prevention is better than cure. should be a way forward rather than treatment like transplantation. With this, I will conclude and participate for other discussion if time permits.
Okay, thank you very much, Dr. Vivek Kutte, for giving your views. And Dr. Vivek has given a very, very clear picture ki how the living organ transplants are taking the front seat, because the brain death, the transplants are not taking much because of the reluctance, because of the affordability, and because of there is no proper laws. Although the guidelines are there, we have a law, everything, but there are so many problems are there. Even for the living, which I will be discussing in my next round with doctor, and then we will discuss why the living transplants are not taking much. So there, what are the reasons that we'll be discussing. Now, I would like to ask Professor Dr. Vasudevan. Professor Dr. Vasudevan, are you there? Okay, I will go to Dr. Raman Kutty first. Dr. Raman Kutty, you have mentioned about the economics in India, and you have mentioned about NHS and other. See, in USA, almost the entire health care is covered by insurance companies. So there, the people are covered, and that's why they are getting all the benefits, and that's why the mortality rate is very low. So many organ transplants are taking place, and that's why they're number one. The UK also, because of the NHS mainly, or everyone is covered there. But in India, we don't have any such type of a scheme. Although now this Ayushman Bharat has come back, but we all know that it's not that effective, especially in North. I'm talking of North India. North India means a state like UP, Bihar, Haryana. Those areas, they are lacking behind like anything. And at least because I am working in this field to create awareness for last 5 years, and I found no one is interested to listen. Even the government authorities are not well aware about the schemes, what the government has prescribed. What you suggest as an economist, what should be done? Whether we should give some insurance schemes for this transplantation covering, or we should go for the NHS type of thing, that it will be entirely free, whosoever will go, or we will reduce the rates, where the government will give subsidy to the private hospital, and they will reduce the rates. Although there is one report which I'm sure Dr. Kutte or Professor Vasudevan can vouch for it, that there's one Dr. Venugopal who has performed the first surgery. He says the cost is for one surgery is about 50,000 to 1 lakh rupees for a private hospital, and they are charging far, far more for the heart transplant. Do you think this is going to be effective, or we should go for the way we are going on? Because if we are going on with the way which we are taking, so many people are dying for wants of organ transplant. What are your views, Dr. Raman Kutty? Please unmute. Please unmute. Doctor, yes, please.
Thank you for the question. I will tell you my views. Of course, first of all, I want to say that the answer is not clear cut. I can't just say it's not easy. You know, the situation is one where you have to think of several options. As you rightly say, our health system is hugely underfunded. So somebody has to pay for this health care. So whether it's the government, or whether it's out of pocket from the people, or whether it's insurance, even insurance, you know, somebody has to pay the premium, and that is a major challenge, because in India, which is we have a labor force where they say that about 80% of the labor force is in the what is called the informal sector. The informal sector, they don't have wage guarantees, they don't have pensions, they don't have. It is a daily wage kind of situation. The economy is where people are living from hand to mouth, kind of. Many states and in the majority of India regions are like that. And we have seen that during the COVID situation, where, you know, people were really not able to meet their own immediate. So the thing is, who is going to, even if the government is going to pay, the government needs that money and they will have to raise it from taxes. Now, I'm sure you are aware that in several years back, about 10 years back, there was high level, before the Modi government came, there was a high level committee on health economics, which recommended to the government that, it was headed by, I think, Dr. Srinath Reddy and all those people. So they recommended that it should be funded from taxes, which means that tax will have to go up. And that is something that will be resisted politically. So that is one of the problems. So that is why government is going for insurance, where if you are employed, then you can pay out of your salary. But what will happen to the people who are not employed? And that has to be taken care of by the government. And that is what is happening in places like Canada and many other places where the government does social insurance. But there again, the problem is that their unemployment rate and the people who are in the informal sector is not so huge, it's marginal. Whereas where we have majority of the people in day wage jobs, so that becomes a major challenge. The government has to raise money somehow for funding this, this kind of healthcare for the poor people. And one of the attempts, of course, they are making is a Ayushman Bharat, which I think may not meet the demand, but that is anyway one step. We can go from there. So that is a major thing. But insurance, again, we have to be aware of the pitfalls also. Even though you mentioned US, we also have to remember that US is a place where by the last count, I think about more than 40 million people had inadequate insurance and they go without proper health care. So that is on the other side of insurance. If you don't have money to pay the premium, then you are out in the street. So that is also something to be avoided. So in between, how to balance this is a major challenge for any government, and I don't see that being solved pretty soon. But I think we have to take the right steps one by one. And one of the steps, of course, kind of propping up the insurance, and all the corporates and major players should be made to contribute to the funding of healthcare. I think that is one of the suggestions I have. Thank you.
Okay, thank you very much, Dr. Raman Kuti, for giving your suggestions.
Can I add a comment to the earlier comment on the cost of the surgery?
Yes, please.
Actually, you were mentioning that the cost of surgery can be kept very low, but we should understand that the cost of surgery would include the cost of the preparation to surgery, the infrastructural costs which add for surgery, the ICU costs for postoperative care, etc. So definitely it is not a low cost affair. We need to provide a bacteria free environment with all the safeguards of preventing intraoperative or postoperative infection. So definitely it will be a higher cost than other routine surgery. Yes. So I think that has to be kept in mind.
Yes. Thank you, Dr. Vasudevan, for giving your views about this. Now I would like to invite one of he has underwent a renal transplant 5 years ago. Is Dr. Sunoj. Dr. Sunoj is a senior consultant plastic surgeon at Aster Medicity, Kannur, and he underwent renal transplantation 5 years ago. We would like to hear from him how much money he has paid, and was it affordable, or what types of problems he faced at that time 5 years ago, although he himself is a doctor. Let's hear from him. Dr. Sunoj, please. Please unmute. Yeah.
Hello. Good afternoon, sir. Thank you for giving me an opportunity to talk at this elite group. Sir, let me introduce myself, sir. I'm a plastic surgeon by profession, and I'm one among the unlucky fellow to undergo the transplant in a way, especially because of the COVID situation. Since it's a highly immunocompromised situation, I couldn't work during the COVID days, and I plan to join back by coming January 2022. Okay. So I was found to have diabetes around 2000 2008, and I worked in UAE for quite some time. My diabetes went uncontrolled, and by 2016, I had a syncope attack. Then I started investigating much further, then later found it out to be something like a complete heart block, which was secondary to vagal inhibition, because I used to vomit a lot in between. Then I found my creatine urea was too high. I went for something like a pacemaker implantation, then followed by dialysis, because when my disease was detected, my creatine was around 2.4, but within some 4-5 months, it went to 9.6. So I went to a hospital at Trivandrum where I had almost 100 dialysis. I'm a single child to my parents. My father is dead. My mother, she was around 62 that time, and she was ready to give me kidney, but because of the 62-year age, and she wasn't having any diabetes, hypertension, or anything. But for some reason, our nephrologist ruled out that it's better to get some other kidney. So since a single child, I don't have any other option. I tried with my spouse. She was having some dual artery, some problem with the MRI angio. So I couldn't have. My kids were studying, the elder one in 8th standard and the twins younger in the 4th standard. So I had only option to go out. So I went to, I thought, and some of my good IMA friends, senior friends like Dr. Professor Vasevan sir and others involved, I couldn't mention some of the names. They told that it's better if you go to a station where you have multiple number of surgeries done. I mean, something like, as previous sir has told, something like 7,000 cases being done. I thought I too will select a center which is more successful, not something like 100 cases, 80 are successful in that way. Then I had the option where to go for a cadaver transplant or to go for a live donor. Here, the cadaver transplant that time, because of some cases in the High Court and all, only 3 cases were done during that time. Means some problem there with the signing of the consent for some person at some hospital in Chennai, and that case was taken to the High Court of Kerala, and nearly it was 0, the cadaver transplant. So the only option was to go for the term altruistic. I don't know the word meaning of altruistic with the transplant, but anyway, I'm putting that word. So we visited a hospital in Ernakulam, which is a high amount hospital. And when we came out of the hospital, my brother-in-law and my wife were the one who were there. When they went to the railway station, they were met by a person, and he told that he is an intermediary person in that. For me, he is an avatar, and for some, he is a bloodsucker. That I can't coin that name. Okay, for me, it's an avatar, that person. So within another 1 month, we got a person, but then I was screened for the angio, and I was found to have a single vessel block. Not that serious, but what my cardiologist advised is better, since you had a complete heart block, you are on a pacemaker, and you are around 42, 44. So I think it was 44 years. So better if you can go for a angio, that would be nice. And I went for a single vessel angioplasty. And then I had to wait for 6 months. As the drug-eluting stent, they were advised to wait for 6 months. And I was on dual antiplatelet. So after 6 months, I had a transplant from an altruistic donor. The paperwork was so massive that I knocked at every door in the administrative, the red tapeism. So from MLA, MP, secretariat, every room, something like the health minister's office, then I think it was something with the judiciary, then with the MP, MLA's office, the village officer, the bank statement. It was an enormous phenomena. And the 7 files duplicate in something like the photocopy files, which we made, counted around 1,200 pages, almost 1,200 pages. And my wife was the only person who was running behind all those things. Though she is a PhD botany holder, but she couldn't find a job in between. We had 3 kids, and I was surviving very well with my practice and as a plastic surgeon. But all of a sudden, we lost the total income. Not much supporting system was there other than IMA Trivandrum, State IMA, and the National IMA. And Vastavan sir was one of the phenomenal person who helped me a lot. The Trivandrum IMA helped me a lot, both financially and in administrative level, and even with the contacts. So further, I could have my surgery done. And then I went into some phase like septicemia. My HbA1c was just 7.5, but I went to septicemia. I had almost 55 days of hospital admission and ICU, and 102 days in some other hospital. I'm not blaming anything, but that hospital couldn't afford to have something like a wound debrimer vacuum assisted closure, and I had to find some other hospital. It wasn't their fault, it wasn't my fault, but it happened. So my bill extended from the initial told amount of 17 lakhs, which included the donor surgery. I had to stay for another almost 2 months or 1.5 months over there. And there itself, my bill went to around 26 lakhs. That about the intermediary person, agent, or a blood sucker, whatever it is, I had to pay a good amount to him. And then to the, I don't know whether I could reveal over here, but I need to pay to the donor too. So that went to around 12 lakhs. I'm not mentioning about the division of the amount to each of us. That happened on something like the previous day of when the 1,000 rupees note was denominated. So what happened was we carried something like, I sold a property and I was carrying around 1,000 rupees note. So demonetization, I put the word wrong. So what happened, I need to change that 1,000. But that means my avatar, what he told, he is ready to take that amount. But somehow I was able to do. I paid that amount. Then I had to pay for the donor. A part of it was paid to the donor then. But on the previous day, in the hospital itself, one of the person came and collected the rest of the amount of the 12 lakhs. Okay, that's my thing. But so since I am a doctor, I was working with the IMA. I was a part of the IMA organ donation thing. So many of the recipients who have received, non-doctors, is recently contacting me in the last almost 1 year. Their biggest problem is the donor, means the spouse of that donor, means something like the husband or wife, especially when the donor is a female. The spouse used to call him and tell, she have fainted recently, she met with an accident, and they're taking something like 15,000, 20,000 every time. And 1 week back, I got a call from one person, a person who got transplant along with me. He told me that, Sunil, I got a calling bell. I opened the door. I could see the husband of that donor, and he was having something like a lotto shoe in his foot. And he was asking me that at least give me 5,000. We need it for our survival. See, so in a way, it's something like an emotional cheating over there. So back to my history, after that I went into septicemia. I had 13 general anesthesia, and I had something like debrima by a plastic surgeon, one of the well-known, renowned plastic surgeon in Kerala. And I was put on vacuum assisted closure. And as all of you know, that vac means something like the instrument with a sponge will be put in your wound, and that will suck the debris and whatever comes for next 5 days. And the cost of that is around 15 to 20,000 per sitting. Plus the anesthesia charges, the surgeon's charges, the room rent. You can carry it to the home, but as a immunosuppressant, it's not fair enough to carry it to the home and bring it back. So I had to stay for almost 102 days. And telling the truth, I took a rented house in Ernakulam, that place where I got operated, for nearly 3.5 months. Then I was shifted to some other district, Calicut, where I stayed for another 2 months. And even the operating doctor gave his house for me to stay, as he was a senior colleague of me, and he was so kind enough to me. Then I had to spend nearly 60 lakhs. 60 lakhs. It includes the fuel in my car, the rent, everything put together, but it went to 60 lakhs. But finally, at least God has given me a good thing that my wife started doing something like a business. She started a cake designer shop, and when the very first month, her income raising was almost better than my income when I was healthy enough. That is only because of the Almighty's grace. Then I couldn't work for some time because I had some problem with the thighs and the right thigh. I don't know which artery or side anastomosis was, but anyway, I had a problem with the right thigh. Later, I started working, and then I started working in Astra and was earning almost double the income before transplant. So it was a fruitful event for me. But all of a sudden, the COVID situation came, and I had no other choice. Just the day on Janata curfew, I need to leave the job, and still I'm jobless. Then another phase I started finding. Some of the relatives, not the near relatives, I don't have a brother, sister, but wife she had, and some immediate members started pampering us, giving us support. But even good doctors, good hospitals, when I search for a job, even as a junior doctor, not as a plastic surgeon, as a junior doctor, most of them were reluctant. They used to tell that, oh, so no, you are earning this much. How can we pay you something like a 60,000 amount? But the problem is for getting the immunosuppressant, good quality branded immunosuppressant, I need to pay around 15 to 70,000, 17,000 a month. And I had some other cardiac issues, so clopidogrel is still there, statins are there. I had to have the insulin, something like 3 to 4. So what all things went through my mind? One, whether the diseased organ is a nice option or a live donor in our situation, in Indian current situation. Diseased organ required. I was very surprised that my elder son got the driving license 1 week back. He crossed his 18-year mark, and there was a column in that whether you are willing for an organ donation in the Indian driving license. I was very surprised to see that. As a recipient of an organ, I was very surprised to see that. Second thing, whether we have something like a high-speed rail or high-speed railways or anything to take other than the helicopters to transport the diseased organ, not only the kidney, other organs too. I was a person who was doing AV fistula for dialysis patients earlier when I was healthy enough. So I know the impact, the emotions in the mind and all. So the second thing about the donor, really when the donor gets into some trouble after giving us kidney or any other organ other than a disease, a live donor, how can we cater them? Can the government nationally provide any insurance policies to them? See, the day before yesterday, it was told that the Maoists, whoever surrender is being reaccommodated or whatever into the system. Why can't a fruitful person, a human being, a person can be turned to be a fruitful? Something like I was very fruitful. For the last 5 years, almost 3 years I worked. Almost, I was very fruitful in my family. My kids were at 4 and 8. Now the elder one is doing the 2nd year law and the others are appearing for the board exam 10th. So I was very fruitful with my family. So it's a living example. Even though I have no doubt whether I should have taken the extended life. That's another scenario. That's not because of, that's only because since we have to deal with such a pandemic like a COVID situation. So I still encourage that more of cadaver transplant should go on. And another one more thing is about the disease and the other thing, about the pneumonia part. I have heard about the pneumocystis carinii, pneumonia, pneumococcal. I had to have so many other drugs, something even from the Septran to the azithromycin in the last 5 years, almost some 10 times. Because whenever I go to the hospital, that's only with me because I work with the hospital environment. I used to visit the ICUs and all. So these type of things, pneumococcal vaccines, the H influenza vaccine, now the COVID vaccines, it takes enormous money from us. Okay, so I was at least bit successful to raise the money. But what about a person who comes below a middle class family from a poorer section? They need to be helped by the machinery, government machinery, the social system, and the other NGOs.
Yes,
Thank
Doctor.
You.
What you have mentioned, yes, it is really being a doctor, and you yourself a doctor with good connections, and you are working with the organ donations of IMA, this thing, but still you face so much problem, and the bill has raised that much. One can imagine what is the situation of those who are poor or middle class, upper middle class. Even I will say only the super rich or rich class can afford, otherwise one has to sell the properties, etc., etc. Thank you very much. We will definitely come back to, I will definitely come back to you and ask some more questions to you and want to know further. But my question now goes to Professor Vasudevan. Professor Vasudevan, he has made one very important point, Dr. Sunoj, is about the unrelated documentation, unrelated person who wants to donate. There are many who wants to donate, living donors, but they are not related. And in India, it's not easy to donate because you have to prove that you are not taking any money. Although we know, as Dr. Sunoj has also said, the committees are passing those cases where the underhand dealing is taking place. But those who want to genuinely donate, there are also lots of problems for the unrelated. And we know that there was a case in Karnataka High Court where one of the lady has gone to donate, the lady or the gent, I don't know, someone has gone to donate for unrelated, and the court has given the permission. Now my question to you is, so much documentation, committees. Yes, it is required because we want to check the corruption in this. We don't want the trading to be take place. But if we will increase the supply, what is the problem? It's like our Dr. Raman Kutty says, it's a matter of demand and supply. But if those who are willing to donate, those who are those who can afford, those who are not interested to take the money, the government should have those come in the committee members which can take decision immediately. Otherwise, we know that how much time and how many forms to be filled up, how many formalities to be done. The living donor will say ki, we are not interested. What do you say about this, Professor Vasudevan?
Yeah, definitely there is a campaign now for faster completion of the regulation process. There is definitely a move for that. Here, what the committee is often examining is there is a lot of falsification of records. There is a lot of impersonation happening. So they need to really prove whether the relationship is correct. And in the case of a unrelated, they have to go to the state committee. What we are suggesting is these committees need to meet more often. There has to be a time limit. Recently, our High Court also mentioned there has to be a time limit for the committees to dispose these cases, whether yes or no, what is the reason for the no. So this has been examined by the court also, and this was a recent decision which came out. There has to be a time limit for examining of each individual case. I think that you once implemented, I think that will speed up this process.
But my suggestion is in this, Professor Vasudevan, why we require a committee to have a meetings monthly or weekly, or why not we have a full-time people who are working there every day. They have to clear. They may change. No problem in that. Like I asked the same question to in USA. Ask this question to you in USA. One of the networking those who are involved in the organ donations and transplant. Their answer was very clear. I said, if I want to donate, how you will know that I am not charging the money? They says our psychiatrists are sitting in the meeting, and immediately they will come to know whether you are telling lie or not. Their questions are such. Why not we have such type of people sitting who will come to know immediately what is the situation? Anyway, thank you very much, Professor
I think
Vasudevan.
can
Yeah.
I just make one more
Yes,
comment?
please.
I
Yeah.
think there is also a suggestion for online submission of these proposals.
Yes,
So
please.
I think that will make this much more faster.
Yes. Dr. Kutte want to say something. Dr. Vivek, yes, you want to say something.
Yes, sir. Sir, as far as transplant numbers are concerned, the deceased donation in India is less than 1 per million population.
Yes.
And in country like Spain, it is 50 per million population. And in terms of unrelated donor, 85% transplants in India are from living donation, and less than 15% are from deceased donation, which is mainly active in south and west part of India. Many states have not even started or initiated the program. So I think the way forward should be the deceased donor transplant program, because in living donation we have the issue like gender disparity. Majority of the donors are women. Majority of the recipients are male. In case of spousal donor, the national database shows 90% donors are women. So I think we should expand the disease donation service. That is a better way, because many patients would not have their family members who are healthy because of medical conditions like blood pressure, diabetes, which are very common nowadays for the parents and spouse. So I think the only way should be the disease donation.
Yes, Dr. Vivek, what you are saying is right. But the only problem in India is that the gender. Yes, yesterday only I was telling, or whenever I do the program in India, the women are donating donor. They are the donors, mainly donors. As you said, 85 to 90% are the women donor. Because the wife wants to give to husband, daughter will give to the father, sister will give to the brother, but not otherwise. And this is a very unfortunate part. And the secondly, until we will not come out with some regulation, which I will come in the next round, because I can see now one of the panelists has joined, and I would like to welcome Professor Dr. Sunil Shroff. Dr. Sunil Shroff is the president of Indian Society of Organ Transplantation. He is the managing trustee of Mohan Foundation. He is the senior consultant of urology and renal transplantation at Madras Medical Mission Hospital, Chennai. Welcome, Dr. Sunil Shroff. And I know that you are not in India. Very kind of you to join at this hour there. Dr. Shroff, we were discussing about the economics of organ transplantation in India. And we know that you have worked many, many years, and you want that it should become affordable. And your organization is doing lots of work, not only for making it affordable, but for creating the awareness for organ donation. And you are the pioneer, I must say, in India, as far as the NGOs or those who are working in this field. But we have heard what one of your colleague, a doctor, suffered for how to raise the funds. The money is the main criteria which is creating a problem, lots of problem, apart from other criteria which are there definitely. We would like to know from you your views on the economics of organ transplantation in India. Dr. Sunil Shroff, please.
Thank you, sir, for inviting me to this webinar. I'm in Seattle, actually. So good evening to all of you and good morning from India. I think, it's not an easy answer. One of the reasons is that we have to make sure that transplants are affordable, and not only the ones who are economically privileged get it, but also people from, who don't have the resources should be able to get it. One way to do it only is to improve our donations and our transplant program in the public sector hospitals. Currently, 90% of transplants are being done mostly in private hospitals. Vivek institution is an exception. So the transplant becomes very expensive. So Government of India has 540 medical colleges. Of this, hardly about 20-25 medical colleges today are doing transplants. The medical colleges all have the infrastructure to do transplants. Of the 560 medical colleges, 260 are government medical colleges. So I don't see why, with a little bit of imagination, you can get the transplant program started at least in the medical colleges. So, Government of India also has a plan to have dialysis unit today in every district of this country. 738 districts, I think. Every district they want to have a dialysis unit. If you're going to do that, if you're going to serve the population with dialysis, if you don't give them a transplant, then your dialysis numbers will just swell up. So it doesn't make sense. You have to simultaneously work towards improving the equity. You have to improve towards making transplant accessible to less affordable people. So the government needs to look at these policy changes and make sure that the transplants are affordable and the lesser privileged people also get it. Today, if kidney transplant on average in a private hospital costs 5 lakhs, and not everybody has 5 lakhs. A liver transplant program costs you 15 lakhs. A heart transplant costs you same, about 15 to 20 lakhs. A lung transplant can cost you 25 lakhs. So how are we going to get the resources? One solution, of course, is using crowdfunding platforms. But crowdfunding platforms can really do so much. And as Mohan Foundation, in fact, in the last, I think, 1.5 years, thanks to Jayaraman in Bombay, from our foundation, she has managed to help at least 10 to 12, lesser privileged families to get transplants today. By saying lesser privileged, what I mean is that they are from lower middle class. Poor people can just not get a transplant in this country unless they go to government institutions. So we have to create this equity by making sure that transplants are available in the government hospital. If you start that, the disease donation programs also improve in these hospitals. Because today, in these hospitals, if they do organ retrieval, they don't do transplant. After a few donations, these government hospitals say, what is in it for us? We are only giving away the organs. So they need to look at this in the larger picture, yesterday was the Organ Donation Day in our country. You know, we have given a lot of awards, but what about the policies? What are we doing with that? We need to be proactive with these policies. I wish the government of India would announce some proactive policies every Organ Donation Day, which has not happened in the last 10 years, unfortunately.
Yes. I think, Ashok. Okay. Thank you, Dr. Sunil Shroff, for giving your views. And I will just mention, yesterday you have mentioned about the yesterday Organ Donation Day. Yesterday, our minister, health minister, has mentioned one. He has given a statement, and I will just read because it has come in the newspaper, although it is in Hindi. The Swasthya Mantri ne angdan karne ka ahvan kiya, and in that the important thing which he said is that भारत अब दुनिया में केवल अमेरिका और चीन से पीछे और तीसरे स्थान पर है. इसी तरह अंगदान की दर 2012-13 की तुलना में करीब 4 गुना बढ़ गई है. See what this statement is.
So what has happened is, well, sir, the number of transplants, actual number wise, we do more transplants. Well, only after America, number of transplants in India, documented transplants. But if you look at the population is very large. So our per million donation rate in our country is still less than 5 per million population. Whereas in America, the per million donation rate goes to almost 50 to 60 if we include a living donation program as well.
See, the unfortunate part is that when we talk about the vaccine, we said, see, India is so big. We have done 100 crores or 120 crores. And America and all European countries are very small. But when we talk about organ donation, we are still behind the America. We are not talking about the population. Anyway, thank you very much, Dr. Sunil Shroff. I will be coming back to you. Please be there. Now, my question goes to Dr. Vivek Kutte. You were mentioning about how to increase the brain death donation. Don't you think that India requires opt-in or opt-out system, one of the system, unless we will not have that system, whatsoever we will do, Dr. Shroff is doing for so many years, I am also doing, so many NGOs are doing, we are just doing, otherwise I feel even if we not do, so much organ donation will take place automatically. What do you say about this, Dr. Vivek?
Yes, sir, this is a good system which already exists in the Spain. But the major limitation for India is just like, even after pledging the organ, the consent of family member is required after death. So at least that should be rectified first. And obviously, opt-out is a better way to go forward.
Okay, thank you, Dr. Vivek. Now my question goes to Dr. Raman Kutte. Why not when in India somebody is saving the lives like on border, how our army force was honored, so many people are honored. A person who is donating, his family is donating organ to save 8 lives and improvise 75 lives without knowing whom it is going. Why not that family to be honored? Why not that family to be given the tax exemptions? Why not they will be giving the passes to travel across the India, free passes? Why not? Why we are not honoring them? Then only we can think that we can increase the organ donation. People will be proud to be that he's a donor or she is a donor. The family, I'm talking of that brain dead. There is no question of money involved. They are doing it voluntarily because it's a brain dead. Why the government is not proactive in this? What you say about this? What is the economy is going to suffer if they will just give some tax exemption or honor them like this?
Actually, I think that's a very good policy move, which if could be put in practice, it probably will promote more disease donations. But unfortunately, in our tradition in India, in policy making is we generally don't, I don't know, some reason governments don't believe in incentivizing people. They think it's something wrong. I don't know why. There is perfectly nothing unethical about it. Because I don't know, I have not seen this and I think it's a good suggestion, definitely. Recently, we saw in the papers in Kerala, one family who donated, I think, several organs from one of the members who was killed in a road accident. Of course, it came out in the papers and everybody was appreciating what they did and all that. But as you said, that ends there. So if they could be given some kind of recognition and also some kind of incentive, more people will be encouraged to do this. At least the governments can try it out. I mean, there's no harm in trying it out. If it doesn't work, they can think of other options. But I think it's definitely a very good solution.
Okay, thank you very much, Dr. Ramankurti. Now my question goes to Dr. Sunil Shroff. Dr. Sunil Shroff, in USA, I have seen, Dr. Shroff, that there is a centralized state systems where they are controlling, they are working 24/7. They are controlling that any death occurs anywhere, whether it's a private hospital or government hospital, it has to be notified immediately within 1 hour to the centralized system, and that they will just see on the screen whether the deceased person is has given the opt-in system or not, because there is an opt-in system where somebody has pledged, and once you have pledged your organs, then it means that the organs belong to the state, and immediately take the action, and they will go there. Go means they already have the coordinators everywhere, and those coordinators will either convince, if he's not opt-in, he has not he has not placed the organs or tissues, try to convince the family. If he's a natural death, then tissues. If he's a brain death, then the organs plus tissues. And simultaneously, if he is already a opt-in donor, then just inform them, take it out. And that's why they are doing so much, but they are working 365 days, 24/7. I personally visited that center. In India, as you mentioned, the district hospitals, I am at Bangalore, we have conducted a program and we were there with the CMO. The doctors here, the transplant doctors themselves says no one from the district hospitals is ready to retrieve the organs. Forget about retrieving, they are not ready to even declare them the brain death. Now, when this is the situation, how we are going to and this 5 lakhs figure what NATO is doing, to be very frank, with due respect to the NATO and the government, it is all false. You know where far better that it is far more. Even if we take 5 lakhs, every minute one person is dying, far more than the COVID. What do you say about this, Dr. Sunil Shroff?
Yeah, Goel Sahab, you've done very good homework. And actually speaking, they're called death audits in US. And if a hospital doesn't report a death, then they're fined $500 afterwards. So there's a penalty there. And so this system is very well oiled. Remember that. Everything is very organized. I want to tell you one thing. In policy making, we have made some good policies in India. You said opt-in system. We do follow an opt-in system in India also. We do have a driving license clause today on organ donation clause on driving license today. It's an opt-in system, and that's what they do in US also. The first thing they do is they go and see the register of driving license, and then they go and approach the family. That's how they do it. And in India, we've just done that. 2 years, it's been 2 or 3 years since we've done that. And today in our driving license, I'm very happy to tell all of our listeners that when you go and take a driving license, it's compulsory to say there whether you want to be an organ donor or not. In fact, I don't know if you people know this, but in the state of Rajasthan, they were the ones who were responsible for making it compulsory. After making it compulsory, they have received 2 lakh pledges for organ donation. This is great. Within 18 months, which is a huge number. So today it may not work, this register.
Compulsory means? Can you just
compulsory means when you go for driving license, there is a clause, when they implemented this, it was not compulsory whether you want to be an organ donor or not. Today, when you're doing a driving license or we are renewing a driving license, a message comes, do you want to be an organ donor? Yes or no? You have to say yes or no. You cannot leave it. Previously, you can leave it, but today it will become compulsory. As soon as they made it compulsory, the NIC software has changed. As soon as they made it compulsory, the pledges have increased like crazy, which is very good. So in India, remember, Goel Sahab, I want to say one more thing. We have this, this is the opt-out system. If you look at opt-out system, except for England, which has recently opted for opt-out. all countries, even for that matter, England, where opt-out system is there, the whole healthcare is with government. 90% of healthcare is with government. In India, 90% of healthcare is private. What happens is when you do opt-out, the trust, because we have trust deficit in healthcare, opt-out will not work in India. We keep saying opt-out, opt-out. Yeah, opt-out will not work because there's trust deficit in healthcare. I say, we had so many scandalous stories in India on health. So in India, in larger kind of picture, opt-out is going to be a disaster for India. It has to be opt-in because we have to protect the interests of the public. But opt-out, maybe we have instruments like mandated choice, like we've done on driving license. So government of India has done some proactive policies. So, and I applaud them for that. And this is very good. So opt-out system in India, unfortunately, is not likely to work compared to opt-in system, which will work. But this is very important to know.
Yes,
we shouldn't talk about opt-in, opt-out without knowing why it is working in Spain. And even in Spain, there is a soft opt-out, which means the families are still asked whether they want to donate organs or not. And if the family says no, they will not take it. Opt-out is only a way of starting a conversation.
Yes.
It is nothing more than that. So let's not get confused into the opt-out and opt-in. In India, what we need to do is we need to create systems. We create green corridors on roads. We need to create green corridors within the hospital. We need to create those processes in the hospital for organ donation. And that's what will work in for organ donation in India. As far as incentives is concerned, I have view on incentives also. View on incentives this, that be careful of incentives in India. Because by giving incentives, you may again corrupt the system. Because again, there is a trust deficit. What you can do though is follow the Israel model. What Israel has done, if you are an organ donor, you get priority if you become you need a transplant. So incentivize it indirectly that way, that if you are an organ donor, you get a priority for transplants. So that way you can incentivize. But be careful of incentivizing organ donation.
Thank you, Dr. Shroff. But I will just add before I will go to my next panelist is what I have seen in UK. What they say is that once you opt out, once you become the adult, you can opt out, or you can opt out anytime afterwards also. Then you will be the least priority for the organ transplant. But if you are opt-in, then definitely you can. But in USA, what they say is once you had opt-in, then after your brain death, they will just inform the family and take the organs. In India, if I am making my will today for the property, that will is enforceable, because although I have earned the money or I have not earned, my parents have given the property and I can give to my son or to daughter, that is my decision. But these organs belongs to me. These are not belonging to anyone else. So my question to Dr. Raman Kutty is, economic wise, when my will is enforceable legally, why my will of donating organ is not enforceable if my daughter and my son or my wife can say no? What do you say about this?
I think it's a very sensitive issue. It's not merely an economic issue. And, there are sort of a lot of problems like how do you affect the sentiments? And policymakers don't want to be offensive to the population. They have to face the election again. So that is one of the things.
But the problem in India is so many people are dying for wants of organ. Nobody is interested to talk about that. That is the problem. My question now, Dr. Sunoj, if you can just unmute yourself. Dr. Sunoj, you has mentioned that so much money, about 60 lakhs. How much is the total amount till date you have spent on your organ transplant, the kidney transplant?
So I could tell the exact amount, sir. The so-called intermediary fellow took 5.5 lakhs.
No, total we want. Total. Forget about the intermediary.
Yeah.
Total how much?
It's something like for the kidney surgery per se, means at the hospital at Ernakulam, I spent 27 lakhs. I had medical issues. I went into septicemia.
No,
so it went to another 15.
Total is about 60 lakhs you mentioned earlier.
Might be, sir, around 42 lakhs I could
42
and 17,000, 42 lakhs. And because of my problems, because of septicemia and other multiple surgeries, then per month I am spending 17,000, 17. But I take immunosuppressant Prograf and Phenolate. Those are one of the forerunning good brands. So because of that, I am spending
so my
70,000
my
per month.
question to all the panelists is, how a person in a poor person, or even I say the middle class person, can afford to go for organ transplant, and afterwards, and living transplant means you have to pay to the donor also, and then afterwards the medicines. Anyone who can reply, because this
Yes,
is
I have once
yes.
again, once again. This paying the donor is illegal in India.
Yes.
Please don't encourage that. What Sunil has done, perhaps this is an exception. And, I don't know where he did it, but as far as the law is concerned, no donor should be paid. If
Yes.
you're paying, remember there was a Hiranandani case in Bombay where donor went to the jail, recipient went to jail, the surgeon went to jail, everybody goes to jail. So in India, it's a very severely punishable offense. Dr. Sunoj may have done it under exceptional circumstances. I don't know where he had it done, but this is not right. We cannot even talk about paying the donors. That's why the disease donation program needs to be promoted, number one. Number two, remember that there are Indian generics which can bring down the cost of medication, and they're equally good. So let us, there are some doctors who don't like to write Indian generics, but we can answer. Some of the Indian generics are as good as any other foreign medication, and that will bring down the cost of post transplant immunosuppression. But having said that, still the costs are not affordable. I agree with that. But in government institution, when you get transplant, like in Tamil Nadu, the medication for lifelong is free for all government patients. So certain states are doing very proactive policies.
That is we have a very, very divide in India. We have North India is suffering like anything. Nobody wants to talk, and they have not even, as Dr. Vivek has mentioned, somebody has not even started the transplantation. Anyway, thank you very much for giving your very, very valuable views. And I'm sure today's program is quite enlightening for our viewers. And today's program has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV India, News Gaon se, Samvad Sarokar News, Bharat Post News, Karu News, as well as it was shown live on Facebook and YouTube. And we always want to give you something which is very, very relevant. And today's program, with so many top experts, they have given their views. So I can only say one thing to the public at large. See, we are, as a civil society, we have to think today we are not in need, but tomorrow we will be also going to be a recipient. If you just think the person who has died either natural death or a brain death, if we can utilize those organs, save so many lives, we are not God, but God has given us power. If we will use that power, just imagine how many families are going to be enjoying because of our one good deed, and that deed is required. And I'm sure today's program with the economics of the organ donation will definitely give some suggestions. As Dr. Vivek has mentioned, we will send a white paper to the government and ask them to definitely do something, give more, create more awareness. If we are not going to force something, but we have to slowly and slowly take some model, learn from others, see what are the good things, whether it's a US model or UK model, whether it's opt-in or opt-out. We may come out with some third or fourth option, but we must do something to save many, many lives. Thank you very much. And thank you very much, Dr. Raman Kutti. Thank you very much, Dr. Sunil Shroff. Thank you very much, Professor Vasudevan. Thank you very much, Dr. Vivek. Thank you very much, Dr. Sunoj, for joining us and enlightening us on this one day after our National Organ Donation Day. And yesterday we did a program with the youth, and I will tell you one thing, the viewers, that youth are very much interested to know, although they are totally unaware about the organ donation. And one of the youth mentioned that she has to Google and then found. So if we all will try to do such type of program more frequently, which Dr. Shroff organization is doing very, very frequently, but everyone from the childhood, we must try to tell what are the advantages. Then only we can be able to bring down the cost, bring more affordable organ transplants, so the economics can work. Thank you very much, and thank you all the viewers for watching our show. Thank you very much.